About 80% of colorectal carcinoma diagnosed is sporadic, meaning there's no genetic predisposition to it. However, 20% we believe does have a genetic component. So what are the most important kinds of colorectal carcinoma which are inherited? There's two main categories: FAP or familial adenomatous polyposis and HNPCC or hereditary non-polyposis colorectal carcinoma. Now there's important differences between the two. However, there are also important similarities. Both HNPCC and FAP under Mendelian genetics are inherited through an autosomal dominant fashion, meaning that you inherit this either from your mother or your father, who pass along the gene for which then you develop the disease at some point in your life. Now, FAP tends to present in a certain type of phenotype. Phenotype means how that gene is expressed. So phenotypically, what we see in patients who do harbor the FAP mutation, which is in a specific gene called APC, if you have that mutation, what happens is your colon develops a carpet of polyps all throughout it, throughout the entire colon and throughout the rectum. And this usually begins at a very early age. In the teenage years, most typically it is diagnosed. The treatment for FAP is to remove the entire at-risk mucosa. This means that the entire colon and rectum have to be removed. And fortunately, though, these days with FAP, we can do this laparoscopically with smaller incisions, and we're now able to do something that prior to the 1980s wasn't even possible, and that is to reconnect or reattach the bowel so that you don't have to wear a permanent bag. That procedure is called the ileal pouch anal procedure, often abbreviated IPAA. And we can do this again robotically and laparoscopically so that people can go on to live a full and functional life. Patients with FAP will still require lifelong screening, not only of the pouch that's been constructed, which is done out of the small intestine, but also they have to be examined through EGD, or a process where a camera is introduced to the esophagus and the stomach to examine the foregut, or the first part of the alimentary tract, where other polyps can also form. HNPCC is a little bit different than FAP, and it doesn't occur in the same time frame. Usually patients who have inherited the HNPCC mutation, which is a mutation of the DNA mismatch repair genes, and there are several of them, if you inherit this gene, which similar to FAP is also inherited in an autosomal dominant fashion, then you tend to develop carcinoma of the colon at a later stage in life, but younger than we usually see in sporadic cases of colon and rectal malignancy. So typically patients will develop carcinoma in their early 40s, sometimes late 30s as well. Importantly, with HNPCC, we see other associated malignancies, the most important of which is in women, uterine cancer. So if you have HNPCC, patients have to be counseled, if they haven't already, about a hysterectomy once they've completed their family. In fact, with HNPCC, many women who harbor this genetic mutation for the DNA mismatch repair genes will actually present not with colon cancer first, but rather with uterine cancer, and that leads to further diagnostics, which reveal then the patient has what's often referred to as Lynch syndrome. Now, HNPCC is quite interesting. It's the inheritance of a DNA mismatch repair gene mutation. So think about all of the genetics. You know that our cells are constantly replicating, and especially things that turn over quickly, like the lining of the intestinal tract and colon. And if things aren't replicated just right, what happens is you end up having a mutation. So we have a proofreading system in our DNA, and these mismatch repair genes examine every bit of our DNA looking for proper binding. For example, the four base pairs, adenine, thymine, cytosine, and guanine, all have to be bound in a specific way. So adenine binds to thymine, cytosine binds to guanine, and so on. And if anything's off, our DNA mismatch repair proofreading system will check that and make the appropriate corrections. But if we don't have that system working properly, then our proofreading is not going to be valid. This is very much like reading through, if you have ever used a word processor and there's a misspelled word and it's underlined, and then you identify that and fix that. Well, that's our DNA equivalent of going through this process. That's our proofreading system that we have built into our own DNA. Interestingly, though, HNPCC, which is an inheritance of a DNA mismatch repair gene mutation, and FAP, which is an inheritance of a completely different gene called APC, and a mutation in the APC gene, can lead to an important entity, though rare, is quite interesting. It's called the Turcot syndrome. And Turcot syndrome represents a great example of genetic heterogeneity. Through Turcot syndrome, a patient with HNPCC can have a predilection for developing a brain tumor. However, the type of brain tumor seen in Turcot syndrome in a patient with HNPCC is usually the glioblastoma multiforme. This is quite interesting because patients with FAP can also develop brain tumors. However, they develop different kinds of brain tumors and malignancies, most typically medulloblastomas. And because this occurs in the cerebellar area, they tend to get ataxia. There are other genetically inherited disease processes related to the proofreading of DNA, essentially. And one such example, probably the best example, is a disease called xeroderma pigmentosum. Now, in patients who have this condition, they can't even go outside because their skin cannot be repaired by the UV damage. And if they go outside in daylight, what happens is their skin is damaged, it can't be repaired, and they end up developing multiple skin-based malignancies, such as squamous cell carcinoma and melanoma. Now, this is a very important entity, and thus patients with xeroderma pigmentosum cannot have any UV light exposure and cannot, in extreme cases, go outside in the outdoors during the daylight hours. Otherwise, they will develop these sorts of malignancies. Fortunately, with HNPCC, which also involves an injury to the mechanism of DNA repair and specifically mismatch repair genes, is not quite as severe as xeroderma pigmentosum. However, it's an important type of genetically inherited colon cancer, and folks with this have to be managed appropriately. So one of the questions that's often addressed to me as a colorectal surgeon is, if I was diagnosed with a genetic type of colorectal malignancy, such as HNPCC or FAP, what would you do differently? Well, certainly with FAP, the entire at-risk mucosa, the lining of the colon and the lining of the rectum, and the entire colon and rectum have to be removed. With HNPCC, we tend to individualize therapy. So if somebody is 90 years old and they've been diagnosed with HNPCC, we're likely to be more conservative and do a more traditional type operation in which just a segment of colon is removed. However, if somebody is younger and is also diagnosed with HNPCC, we would certainly counsel them about a more radical operation to remove the majority of the colon and to put them at less risk in the future of developing a synchronous or second cancer in the future, technically called a metachronous colon or rectal carcinoma. Certainly, the other factor we would consider in females is to remove the uterus once that patient has completed her family. And this is because the lifetime risk of developing both colorectal carcinoma with gene-proven HNPCC mutations in the MMR genes and the lifetime risk of developing uterine cancer approaches 80%. So what do we mean by mismatch repair genes and replication of DNA? So the way that we end up having errors as our DNA is replicated is that, remember, DNA is built up of little tiny blocks called base pairs, and there are 4 of them. Only 4 make up the entire human code. It's kind of amazing, but A, T, C, and G, or adenine, thymine, cytosine, and guanine. And these have to be balanced or matched in a certain way. So these base pairs have to link up with one another. So it turns out that only an adenine can bind to a thymine and only a cytosine can bind to a guanine. And when we have a mismatch of those, our proofreading mechanism for DNA comes into action and says, wait, that's not right. We gotta fix this. And so that's how this process works. But what if those proofreading mechanisms, those proofreading genes are not working properly or have a mutation? Well, then we may have an error in the transcription process, and then the DNA ends up being replicated improperly or incorrectly. Now, FAP is a very interesting kind of disease because if you inherit the FAP gene, again, through your mother or through your father, through Mendelian genetics, then your chance of having phenotypic expression of the disease is essentially 100%. And that means that most folks who have inherited this gene, men and women alike, will develop polyps throughout their entire colon and rectum, i.e. the phenotypic expression of the disease by the age of 18 or 20. And the chance of developing colorectal carcinoma is nearly 100% by age 40. Now, this can be circumvented through surgical treatment and by removing the at-risk mucosa, that is the colon and rectum. There are a couple of variants of FAP that are interesting and important to know about. And unlike this classical FAP, which is inherited through an autosomal dominant fashion, these formats are inherited through the autosomal recessive pathway. So, in other words, your mother or your father may not have had the expressed disease, but if those two recessive genes, one from your mother, one from your father, are passed along to you, then you can express the disease, whereas your parents would not have expressed it. And these autosomal recessive patterns are sometimes seen. They're often attenuated. Attenuated meaning that there's a lesser degree of the number of polyps and so on within the colon and rectum. So there's much more sparing, and there's not quite the phenotypic expression that we see with FAP. These important categories are the MYH gene, or often called the MUT-Y gene, and they're essentially an autosomal recessive form of FAP. FAP itself can also be attenuated, meaning that you have inherited the disease and it has been inherited in an autosomal dominant fashion. However, the expression or the phenotypic expression is not so severe, so there may not be hundreds and hundreds of polyps, but maybe 50 or so throughout the entire colon and rectum. And this is called attenuated FAP or AFAP.